All right, so we're going to shoot this spinal exercise routine. This is the basic routine. Just a couple of points. If you have back pain when you're doing most of this, you can continue to do it. And if you have some leg pain, then you should probably talk to myself or Dr. Hetzer about it before you continue. Some pain is okay to deal with, and then some pain is not. This is going to be 10 exercises, 1 minute per exercise. I have a little app on my phone that's going to prompt us when to switch, and you can use this video as a timer as well as how to do the actual exercises, and then we'll be shooting an intermediate and an advanced at some point in the future as well. So with that, we're going to get started here. This is going to be standing range of motion, and that's going to start. This is basically this exercise where we go forward, backward, and sideways, just like this. And you don't have to go fast because we're going to time instead of to reps. So it doesn't matter how many reps you do when you're doing this exercise. You are looking for symmetry on both sides. You want to be able to go down to the right as far as you can go down to the left. Good, that's our halfway point. Good. Keep going. I put my hands behind the knees so that we can get a little bit more flexion in the back. Again, if you have a little bit of pain, that's okay. Got about 10 seconds. Good. Keep going. Forward, back, side, and side. Good. Okay. Next is going to be quadruped. Now we have a 10-second rest in between each one of these, and this is to allow you to get set up for the next exercise and me as well. So here we go. Quadruped. We're going to go down and up. Okay? You want to get a good sag. This is called sag right here, and this is called arch. Again, if you have any pain with doing this, it's okay. You don't want to cause too much pain, but a little bit of pain is okay. And actually what you'll find as you do these is that you will not have as much pain in your back. This is going to really condition your back muscles to fire and clean up your motion. That's what I call it, having clean motion. And it's going to support your spine better. It also helps to pump those discs in between the vertebrae, which is really important. Those discs need nourishment in order to be healthy. And without motion, they don't have that nourishment. So many patients that I treat have lost a lot of height of those discs, and it's because of a lack of pumping. These exercises will help that. Okay, here we go. So supine arch and sag is next. I'll turn this way. Here we go. 3, 2, 1. Okay, for this one, we're going to make a bridge right here. Then we're going to push down and come up with your upper body, just like that. So bridge, push down, come up. Okay? When you come up, your back is flat against the table or flat against the floor. Okay? Bridge, push down, come up. Just like that. Up with your stomach, down with your stomach, up with your chest. That is the halfway point. Keep going. Down and up. Up with the stomach, down with the stomach, up with the chest. Keep going. Again, don't worry about the reps, just do it for time. So you can slow it down or speed it up depending on what you can handle. You're definitely going to feel this. I already feel my core muscles. There's 3, 2, 1. All right, next. Lower trunk rotation for this next one. Just take a little rest. 3, 2, 1. Okay, lower trunk rotation looks like this. You're just going to rotate over, stretch those muscles. Then you're going to rotate over the other way, stretch the other direction. And you're looking for symmetry here. If you feel tighter on one side than the other side, then you need to work maybe on that one side. And you can do that outside of this 10-minute routine. Obviously you can do anything you want after the routine, but I feel a little bit more tightness going to this direction. That's the halfway point. Keep going. And if you feel some popping or some things moving around in your back, that's okay as well. That's not a problem. Keep going. It's really good. Stretch it out. Keep Keep going back and forth. Good. There's 10 seconds left. Keep going. Good. Actually, that was it. So now we have sitting piriformis. Okay, so one leg up here like this. You're going to lean over. You're just going to feel this stretch. You're going to feel this in your glutes. So right back in your rump, basically. And we're going to do half of it on one leg, and then the other half on the other leg for this one. Just lean into it and stretch. If you have a hip replacement in either hip, you might not be able to do this. In fact, don't do this if you have hip replacements. That's the halfway point. We'll switch. And again, you're looking for symmetry. Now for me, this one's a little bit tighter, so I have a little bit of work to do for this one. You can sit in a chair, edge of a bed, table like I'm on, whatever you'd like to do this. You're just going to hold it for 5 to 15 seconds and then come off of it. And no bouncing. There we go. 3, 2, 1. Next exercise, 2-leg bridging. Alright, so 2-leg bridging is this motion here. What you want to look for is a nice straight, body. You don't want to be sagging like this. We're going to come up and then down and then up, and you're working your glutes, your hamstrings, and your lumbar muscles. Down. You're going to hold this for about a 3 to maybe even 5 second count. You don't want to be just going up and down, up and down. You want to actually sustain the hold just a little bit. Just up and down. That's the halfway point. Keep it going. You might feel this in your quads a little bit as well. Feel a little bit of stretching in the quads. Definitely working the core muscles here. Pumping that spine, pumping those discs, strengthening those muscles that support your spine. Very important. It's good. Probably getting close. That's the 10-second mark. And good. So now we have prone lumbar stretch. Alright, so this one is this activity here. What we're going to do is come up into this stretch position for 3 to 5 seconds, maybe even 10 seconds. Then you're going to lower down. And the important thing is that you keep your stomach on the table or on the floor. You don't want your hips to be raising up like this. That takes away the stretch. Now, if you have back pain with this, it's okay, because that back pain will actually improve over a period of time. But that's the halfway point. If you have leg pain, then you should not be doing this probably. You need to be diagnosed with, properly in order to, find out why you're having leg pain. It could be stenosis or herniated disc or anything like that. And you can also go up like this if you need a little bit more stretch, but again, you are keeping your stomach on the table. Very important. So almost done. It's 3, 2, 1. Good. Okay, next is going to be side planks. Side planks, you're going to get into this position here. This is going to be at the knees. The intermediate or advanced exercise will have side planks from the ankles. If you feel like you can do side planks from the ankles, go ahead and do it now. What you don't want to see is any kind of a collapsing of your core. You want to come up like this. If you have a bad shoulder, you will not be able to do this. Just skip this exercise. Move on to the next one. You get a little rest period. You're going to hold this for about 3 to 5 seconds. And you're stimulating your core muscles, of course. There's your halfway mark. And go over here and back into that position. You're going to hold it. Come down. When you come down, you might feel some stretching in your back in a muscle called the quadratus lumborum, which is a good muscle to stretch. You're also working your quadratus lumborum when you get up into the plank position. You have to have 2 good shoulders for this. Okay, good. Now we have prone hip extension. Let's get set up. So we're in this position. You can even lay down all the way, and you're going to raise the leg up, and you're going to hold it for another 3 to 5 seconds, just like that. You can point that foot down if you want to get a little stretch in your calf muscle. Just point that foot down, keep the knee straight, and just feel that in your glutes, your back, your hamstrings. If you have a tight hip flexor in the front, you might feel some stretching in the front of your hip. "20 seconds. All right, 8 seconds. Keep going. For some of you, this may be challenging. Good. Hamstring stretch. It's the last exercise. Okay. I like to stretch the hamstrings this way, which is a sitting position. If your back hurts when you do this, you might consider to lay down and stretch it like that. Normal is that you can reach about halfway down your foot, okay? So just start out light at first, and then if you can get down your foot, great. I'm a little bit tight today. You're gonna go about 10 to 12 seconds, maybe even 20. There's no magic to it. That's the halfway point. You're just gonna spend a minute stretching your hamstrings. Now, if you spend a minute stretching your hamstrings, it's about a minute longer than most of my patients stretch the hamstrings. So a minute's better than 0. And if you want to spend a little bit extra time, these stretches can definitely be good if you spend a little bit of extra time. This routine is meant to give you some structure so that you can have a routine to do and you don't have to wonder how to put these exercises together. So that's the end of the workout there. If you have any questions, let us know in the office. And again, we'll be shooting the intermediate and the advanced routine sometime in the future. So you'll see those up as well. So hopefully this is helpful to you. We'll see you next time.